because she was 22 years old and had a stroke.
Wow.
Because of drinking energy. I know that, so I wouldn't suggest it. If they're not doing that,
That's the only one I drink.
On the handout I just gave you, flip over to the third page of that.
Third page.
Third page.
1, 2,
It says therapeutic exercise, section 2 on top.
Yeah, sorry, I couldn't get that off.
Oh, it's on all.
Yeah. We're gonna start on page 173.
okay, so I'm just gonna go ahead and ask because this is really me. Are we not going with these today?
We're gonna do what I think. Okay, so when we do long bike rides, like 100-mile bike ride, we always stop there. Not Dark Beverage, not Sprite, not Ginger Ale, not Mr. Pibbs. And on the Ironman run, they had flat Coke on the course, on the course. That's almost all I had during the whole run.
I mean, I like flat on the.
Well, it was flat because it would go easy.
Yeah, well, that's what I'm saying, I
Like
like
if
carbonated.
it was high carbonated, it would take longer to drink, and you could just go whoop with flat.
I don't like carbonated pop at all, anyway.
That's good.
Flat root beer, oh my gosh, it's like the best thing ever.
Okay, so we are talking now, at the top of that third page. We're gonna get into some recovery things today. We're gonna talk a lot about different things today, but, what we have is adequate recovery time must be built into all resistance exercise programs, both intra-session and inter-session. Now, what does that mean? What is intra-session?
I don't know where you're at, but my book's a new one.
I'm in the notes at the top of page 3.
Are they in the book too?
Yes, but
I tried to.
I'm in the notes on top of page 3. So what does it mean to be intra-session and inter-session?
Intra is between, inter is in.
That's right. So intra, we're talking about rest should occur in the session, intra-session. Intra, meaning within that session,
Okay, I'm backwards then.
okay? That means within that session, we have breaks, right? When you assign someone resistance training, Blake doesn't go out and do resistance training for 60 minutes straight, does he? He has rest periods. And so what we're looking at here is, this is the rest period, the intra-session rest period. Now, if you look down, recovery from acute exercise, where the force-producing capacity of muscle returns to 90 to 95% of the pre-exercise capacity, usually takes 3 to 4 minutes. So what we're saying is, if you do something that takes a lot of intensity, we're gonna wanna let that person rest for 3 to 4 minutes
So
to
like,
get back to 90 to 95%.
so like if he's working bench, he would do a set, give about a 3-minute break, and then do another set.
That's right. He needs about a 3 to 4 minute break.
You know that? Lecture?
So intersession.
Did you know that?
I don't think I would take that long a break usually,
Really? No, why do you not take that long of a break?
just to cool down too much.
You think you cool down too much?
Do you,
Don't wanna be there all day.
I thought he would because he wanted to push his muscles farther or something.
Well, and that's kind of the thought of a lot of people. I mean, I ran the other night with a guy, we were doing speed work at the track, and a whole slew of guys. And we did 800s, and they said, oh, we only get 2 minutes. And I said, where do you come up with this 2 minutes? That's just what we do.
What was your time?
Well, hang
It's coming.
Oh, it's coming. 3:06 was my 800 meter time. Is that good enough?
I'm not gonna say anything, 'cause
So
I've
put that in your
obviously-
Uggs and smoke it.
I've obviously hurt your feelings, and it wasn't intentional.
Oh, but it was. Anyways, we're running, and this guy, he says, and he's a good friend of mine. I hug him all the time when I see him. I said, where did you get this 2-minute rest? He said, that's just what we do. I said, well, who designed this? He said, well, a coach designed it. And I said, well, what literature is he basing this off of? They had no answers. You know what we call those kind of people? Sheeple. They just follow in a line. They're like a sheep. They're just a sheep. They have no input whatsoever, do they? I don't like that. Can you tell? I don't like that. I said, well, please tell me where this comes from. Show me the data. Can you show me the data? No, you can't, because there's none in what you're saying. Here's the data. This is what the literature says. It takes 3 to 4 minutes for you to get to 90 to 95%. This is just close. This is not in everybody. Some people are going to be closer to that 3 minute, maybe a little under, right? Some people are going to take that 4, maybe closer to 5. I don't know, right?
I got a question. You're doing like the interval where you're running and you don't actually completely stop, you just reduce. Would you still do that 3 or 4 minutes to reduce and then speed
Maybe
back
even
up?
more. And that's a whole different concept. Because what we're dealing with is not finite numbers anymore. We're dealing with the populace that says this is about what we see, all right? This is our best estimate, is because people are individuals and they need different things. And they have different levels of fitness, right? So it could be more, it could be less. This is where we know things kind of tend to, and I'll get into the book here in just a second with some very specific things. Go ahead and cruise on down. We've talked a lot about intensity, and we're going to get into that a lot today. I don't really want to talk about it in the notes right there so much. What I want to do is I want to get into, on the next page, if you'll flip over.
Okay, so wait, in the intercession, we should write.
I'll get into that. I'm gonna answer that here in just a few minutes.
Okay.
I'll come back, I promise. Going down to volume. Today in lab, we're gonna do some things about repetition maximum. And that is a talk in its own, and so I'm gonna save it for lab time today. But I want to talk right now about volume. And on page 173 in your new book, we talk about volume. Volume is the summation of the total number of sets and reps multiplied by the resistance used. So what we have is repetitions. The textbook defines repetitions on page 173 on page 173, yeah. A repetition. The number of muscle contractions occurring to move a limb through a series of continuous and complete excursions against a specific exercise load. So part of volume is repetition. other part of volume is a set. And a set is the number of repetitions that are performed in one bout. Everybody good with sets and repetitions? This is kind of common stuff. Most of you have probably heard sets and reps before, and so it's not new. When we look at sets and reps, there's an inverse relationship between the number of repetitions, and I'm writing the notes right now, and the intensity of the resistance or weight. That means if you increase resistance, your reps should decrease. And if you increase repetitions, then your resistance should decrease. That's that inverse relationship. Now, why would you think I would throw that at you? It is. What'd you say?
You don't wanna overdo your patient.
You don't want to overdo your patient. Remember, you're dealing with people who are probably at some point sedentary, or the same as sedentary, because they are in disuse atrophy at some level, right? Because they're at a point now where they need you to come in and intervene for them. And so if you come in and intervene, you don't want high resistance and high reps, do you? What's going to happen then?
You get hurt, hurt.
They're going to get hurt more. They're not going to like you. They're not going to be able to tolerate this. Right?
Quit on it.
They're going to quit. They're going to bust.
I know this from experience.
Yeah. That's exactly right. They're going to quit on
You
you.
quit more than once or something there, or?
On exercise programs, about 100,000 times.
So looking at this little graph down here below, we're going to cover this in lab today, but just kind of to get your brain working on this, there's a thing called a rep max. And a rep max on page 172, there are two main reasons for determining a repetition maximum. One, to document a baseline measurement of dynamic strength of muscle or muscle group against which exercise-induced improvements in strength can be compared. And two, to identify initial exercise load, the amount of weight to be used during exercise for a specific number of repetitions. This is kind of what we can use. If they can get 15 reps, that's about 60% of you should be using the resistance or the load of about a 1 rep. You're using about 60% of the 1 rep max. If they're at 10, it's about 75. And 4 to 5 is about 90. Now what you should see there is the more reps you have, the less of the load you're using, right? So what did we just say just a minute ago? Increase the resistance, lower the reps. Increase the reps, lower the resistance. And you see how this falls in? This is a graph that we'll use this afternoon, and we'll talk some things out. Go ahead and don't worry about rep max zone right now. We're going to catch that this afternoon too. But look at the next page where it says no optimal number of repetitions exists for improving strength and endurance, only ranges that will elicit certain reactions or adaptations. So what we did is you created a regimen for a person, and you used ranges, right? You used maybe 3 sets of 12 to do strength. And this is a range. The reason it's a range is because we can't pin this down. Do you understand? This has to be very individual. And as a person really grows and understands more about what their body's responding to, if they stay with exercise for several years, they start to see very clearly what their body's going to respond to. Remember,
Early on, it would be wide open, but you would narrow it down as you work.
you
with
keep
it.
narrowing, yes.
Like,
and-
he's probably a pinpoint, knows exactly what he can do.
Right.
Okay.
And I told my friend the other night, I said, I'm not going to do 2 minutes worth of rest. Well, everybody else is. I said, well, everybody else is the sheeple, including you, sucker. I know what my body's going to respond to best. I do.
15-minute rest.
More than 2. And tonight, I'm going to have that same conversation. I promise. I promise we'll have the same conversation at Speedworks tonight. Why aren't you just doing 1 minute rest? Why are you? And he's not going to be able to answer because he doesn't have the data. I know what I could do. Now, I showed you Ryan Hall a few weeks ago, and he's the guy that had like the 7-foot stride in his run. That's huge. I mean, he's moving almost 7.5 feet every time he takes a stride out. The unique thing about Ryan Hall is he had a big contract to go and run for a company, and they wanted him to use this coach. And halfway through the training, he left. He just split, said, I'm still gonna do this event, the Boston Marathon, but I'm not gonna work with this coach anymore, because that coach is setting up for 10 runners the same workout. And it's not working for me. It's just not working. So he split and said, I know what works for me. And you know what? Your individual patients know a lot of times what's gonna work. And so you really need to talk to them and connect with them and understand what is working. Because when I talk to a patient, I'll say, how did this make you feel? When we did 12 quad sets. In fact, I've got a knee patient right now. I said, how does 10 quad sets? She said, quad sets really hurt. So, quad sets are good. They really are. But she's also doing a lot of functional things. But quad sets still hurt. So you know what we did with quad sets? We minimized our quad sets. That's not our focus right now. We're going to do some other things that are more individualized to her. But there's a whole lot of people who have total knee arthroplasty and quad sets don't hurt. And so we really focus on those quad sets. But for her, we're just kind of taking quad sets to a back seat because that's just not working real good. And I need to keep her on a higher level and keep her going. And so if quad sets are going to diminish that, I don't want to do that, right?
But if they hurt, they don't need to strengthen it more?
If they're hurting in acute, sharp pain, then I don't want to strengthen that. I don't want to keep doing that because I'm going to end up hurting myself on the whole because they're not going to want to continue with therapy as much. And so they're not going to be compliant to their home exercise program. In fact, we yanked quad sets completely out of their home exercise program.
Will you eventually get back in her?
Sure will. Next week, hopefully. I'm hoping that she kind of turns the corner. You know what I mean? But if I become an antagonist by saying, no, you got to do these quad sets. Listen, what heel are you going to live and die on?
Right.
It's real important that you pick your battles.
Can you just bring the repetitions back down on them?
We do. What we did was we've stayed low on our reps and tried to do, multiple sets to get kind of the same number in there. But she still says, oh, that's the one that really, really hurts. I said, well, let's just do a few, we'll keep
So did
doing.
you take it away because the part of it?
I didn't take it out.
psychological or
I
whatever?
just took it down. I just really lowered it. It's just not the important part. Because here's the thing. What does a quad set do? Terminal knee extension, right? Okay. But a quad set in the open kinetic chain, think about it. What does it look like? You got that picture in your mind? Remember what a quad set looks like? Open kinetic chain, right? Now, let's do this. You know what doesn't hurt her? We're standing in our walker. What am I doing?
Close kinetic chain.
Terminal knee extension
And it
in
don't
the
bother?
closed kinetic chain.
And that don't bother?
Holy smokes. Look at Sneaky.
See, and that didn't bother? So you think part of it was probably up here?
No,
Okay,
but am I gonna live and die on, well, you gotta do your quad sets. Let's be creative.
right.
Did you tell her it was the same?
Heck no. You know who's smart? This guy. You gotta be smarter than your patient, right? Don't you? Every day. Because if you're not, then they trick you. But look, I'm in my walker. And the more I get her to lean on that and do it, now I'm gonna take a rubber band in there called a Ther band, and I'm gonna hold it. She's gonna pull against it. Uh-oh. Now who's doing a quad set, baby? With some resistance. It's no longer, you can't even call it a set, right? Because it's not a set, it's not an isometric anymore. We've advanced.
So it's
And we're
the
getting
same
the
thing, only
same-
different.
Same thing, only different.
So now doing squats.
Do what?
Instead of different sets, right?
Yeah, and you know what I'm documenting? That she's doing terminal knee extensions against resistance, which is higher level, progressed, and it's more functional. she'll get more out of doing that, won't she, than a quad set?
Plus she'll get satisfaction, because she doesn't have to do what she didn't wanna do.
That's right.
So she
Now,
thinks she outsmarted.
You're with me. We're on the same line, baby.
You're working a lot like a woman there, you know that.
Yep.
That's psychosocial.
I've been around a lot of women in my life.
Listen, I'm giving
They
you.
just brag
They
about
just
it.
try to,
That's 'cause I'm
they
fat,
just try to
baby,
let us
you
think
know.
we're
They
in
make
charge.
medication with that, Jim.
You know it? They just try to let us think we're in charge, we never really are.
No, I raised 3 daughters, I know.
Know how we work?
Alright, so we improved muscular strength,
Still
didn't we?
surprise me all the
You
time.
guys already know this. Look down at the second quarter of this page. Improved muscular strength, 2 to 3 sets of 6 to 12 reps that cause fatigue. We really want them to be in a fatigue state at the end of our set. We do. Because we want them to say, I need that 3 to 4 minutes to rest. Because I want to recover back up to 90 to 95% before I do this again. If 3 times 12 is reached and there is minimal fatigue, resistance must then increase. This is in the textbook, and I'll show you where. But if you get a person doing 3 to 12 or 3 sets of 12 and they don't have a lot of fatigue,
Not working hard.
it's time to increase the resistance. In fact, when people say, well, when do I increase resistance? When they can do 3 sets of 12 at this resistance, that's when you need to increase it. If they're having minimal fatigue, if they're knocking out 12, kick it up. Right? That is your objective measurement right there on when you increase, when you progress. And if they're doing 3 sets of 12, and they're doing them pretty easy, you need to go ahead and increase the resistance. Some variable can be increased, right? Sometimes resistance is just increased by taking their hands off the counter when they're doing squats and having a gait belt on them, and they don't have that balance component. Now see if we can do 3 sets of 12. Still doing 3 sets of 12? Put a dumbbell in their hand, in both hands. Now we've increased resistance and we're working on balance, aren't we? Because if I have a person holding the kitchen counter while they're doing their squats, they've got a stable place to do their squats. But if I take them off and I've got a gait belt on them and they're doing squats, this changes a lot. But maybe their hands are close. That way if they feel like they need to, they've got it. Is that not a resistance variable?
Well,
It's not in
plus it
data.
up all over the place too, probably.
Well, but they're not used to that. So you can increase resistance. Okay, it's not in the idea of you put more weight on them, but you've increased their resistance because they are challenged in a new way.
Sterilizing.
Overload must be made every time. Do you see that? That's how you overload. And when we talk balance, there is a question that used to throw people into a tizzy on the test because they didn't see that that was something that was overloaded. You have to overload. Okay? Improving muscular endurance, the book said we can do 3 to 5 sets of 15 to 50 reps. If you're doing 50 reps of anything, do you hope that you have a low resistance variable? You sure do, don't you? When muscles are immobilized from injury, type 1 fibers atrophy at a faster rate than type 2. Look with me real quick on page 173 at the very bottom. Clinical tip. When injured muscles are immobilized, type 1, slow twitch muscle fibers atrophy at a faster rate than type 2. There you go, what I just said. I put it in the notes, but there you can see it in the book. So what's more important? Strength or endurance early? Endurance. We got to build endurance back. That's the first thing that they're going to lose. If you're not working endurance first, you're not pinpointing what needs to be made first. So we'll do exercises that are addressed more for endurance.
Internet radio.
I thought the endurance ones were talking
He's about to cuss.
They can't do strength. They can't do strength without, and you have to do it anyway.
Oh, you don't want to do it online.
What'd he say?
Who's he got in the office with him? You gotta lick it, I think.
He said you just have to lick it. Did you hear that squeak? That's what I think It's his time, I think.
He's interviewing for a new work.
How did he even turn that on? How did he even turn that on?
Yeah, he's interviewing for new work.
So you did all
No.
purpose?
Is her name Monica?
Okay. So, let's talk about how to do an exercise order. The book tells us that we need to do things in a specific order or sequence so that we do things that attract certain hormone responses, that attract certain bone rebuilding or remodeling responses, that we attract things that are for mitochondrial responses, and here is the way it looks. Large muscle groups before small muscle groups. So, help me out with this. Lifters, what's a good large muscle, or a good multi-joint muscle, or a good higher intense movement over a small, or before a small, before a single, before a lower? Help me out with this.
You like squats?
I always do like.
Yeah,
Say what?
you like squats to begin with, and then.
Squats to begin with?
And then maybe work down to just the, like, leg extensions, and,
I agree, but what you need to know is I hate leg extensions.
yeah, but,
If you meet a therapist that likes leg extensions in your career or in your clinicals,
Let's move on.
well, no, challenge them
Oh.
before you move on, and then you may have to move on. But ask them, say, can you show me the data that really promotes that?
How about we just send them your way?
No, I don't want them. I have to deal with enough of those kind of people.
I think that when you're.
Give us an example like.
Yeah, that's a good idea. Challenge
Okay,
them.
well, we did. Well, we're not off this yet.
squats.
Weston said squats first,
Mhm.
okay? Let's say, what is a squat? Is it, let's put it to the test here. Is it single or multi-joint? Multi-joint. Is it large muscle or small muscle? Is it high intensity or lower intensity?
I think it's pretty high.
I think it's pretty high. Yeah, a squat's a big old movement, isn't it? So I would want to do the squats before what though? What's on the other end of that spectrum?
I use my hamstrings and calves.
Hill raises,
Yeah, before like a hill raise exercise. What's a hill raise do? It's your plantar flexors, so then it goes into the calf. I mean, even if you want to get technical and say, well, if you're dealing with the gastroc, it's a two joint muscle.
But you're really just working the one
But
joint.
still, let's be clear here. You're isolating one muscle. It's a small movement, right? But a big movement is the squat. What about a lunge? Is it a big movement?
It is for me, I was sore if we did lunges.
Boy, I was too, brother. Listen,
Yeah, Iron Man, I hear you.
no, hey, squats, they hurt. Lunges hurt. They hurt. And you know, the idea is what we're doing is bigger movements first. And a lot of people are like, well, I don't want to do those big movements first. I want to do a warm up. Hang on, let me do my warm up for squats. How does that warm up for squats? Shut up. I don't know that there's a warm up for squats, is there? You're doing squats, you're doing squats. It's going to be a big movement. You know what a warm up for squats would be? Squats without weight, resistance.
But that squats without weight might be their maximum though, if they're like not very physically inclined.
It might be. Yeah, okay, what? A wall squat would be a good warm up for a squat. But what we're talking about is doing bigger movements, and then they taper into the smaller movements. And what we see is, like I said, you're seeing metabolic or hormonal responses,
Could you do-
you're seeing remodeling, bone remodeling responses that are bigger, and that's the best way, the data tells us this is the best way to do an exercise, order. Okay? So when you see a test question, what are you gonna look for? You're gonna look for big movements flowing into small movements, okay?
For like your lunges, to work them into like an actual walking one, would you do single leg lunges?
Yes, if you were doing, this is the thing, we're looking at how to progress. Okay, so frequency is the number of exercise sessions per day or per week. Look on page 174, under frequency, refers to number of exercises per day or per week. Now, I like you to understand here that it's very common in therapy that we assign people to do things BID. What? Twice a day. We assign people to do things BID because this helps people to get better faster. Now, in some cases, it is not appropriate to do that, especially in the maximal protective phase. And I'm going to let Bill articulate this in Ther Ex II, but what we know is that there are some people who are not going to respond to BIDs. There are some people who are going to very much respond to BIDs, and so I'll let him take it from there. But middle of the paragraph under, or end of the first paragraph under frequency, find this statement: the greater the intensity and volume of exercise, the more time is needed between exercise sessions to recover from the temporarily fatiguing effects of exercise. So, if you're going to write a BID frequency, what's your intensity going to look like? It's going to be low. Makes sense, doesn't it? You're like, oh, got that. The last statement in that paragraph. Tell me if you can't see a multiple choice question out of this. A common cause of decline in performance from overtraining is excessive frequency, inadequate rest intervals, and progressive fatigue. Does that not look like which of the following is not? Does that not? Okay, just throwing that out there. Even in red, what is, hang on, Miranda, what does this red statement say next to my book where I've got that highlighted?
Queer for exam.
Not queer, question. She thinks it says queer.
Frequency.
She just can't read my writing. Q-U-E-S-T, not Q-U-E-R.
Intensity, duration, type, and time. I mean, it's all-
Yeah, and progressive fatigue.
Got a 3 to 4 minute rest on that. Yes.
So, some forms of exercise should be performed less frequently than others because they require greater recovery time. I'm in the next paragraph. It has been known for some time that high intensity, eccentric exercise, for example, is associated with greater microtrauma to soft tissues and higher incidence of delayed onset muscle soreness than concentric exercise. It is well known within the running community of POTO that if you're going to run up Kavanaugh, you better ate your Wheaties if you're going to run down. It's not the up that hurts. It's not the up that leaves you sore for a week. It's the down that leaves you sore. Now, if you got sore for a week from going up it, kudos.
We went up and, the up was hard, the down was easy.
That's
No
what you
way.
thought. Up here it was easy, down here not so easy.
No,
Your muscles were going, what are you doing
The
to
back-
me right now?
The back of my knees killed me. After coming down, the back of my knees was,
It's insane.
and even my trunk. Why my trunk?
Because you had to stabilize going down.
The
And
whole
you're
time.
eccentrically trying to correct the whole way down. The eccentrics are what kills you. It's not, now the concentrics do, don't get me wrong. For the lower, until you get used to it, it's gonna definitely reflect in concentrics. But if you go down it, like, there's a whole group of ladies who were just driving to the top, running down.
I could imagine
Oh,
running,
my face.
yeah.
Yeah. Some of those angles are steep. Or, you know, it's steep. So here's
You'll
what I'm
know
telling
the
you.
day I tried to run it, cause it'd be like road rash. Right on the face. I'll be
I
missing
know.
part of the tip of my nose.
Listen, I've toppled a few times down it.
I will have to wear my helmet,
Do it.
You're just sliding down.
I'm about getting hot.
because
It's cool enough.
when it tornadoes, my daughter wears her motorcycle helmet. That's what I've got pictures of her sleeping in,
Yeah,
cause I've convinced her at a young age she'd be safe.
that's good. You have her trust. So
How you
what
think
I'm
about it?
doing today is I'm still trying to like get my quads to talk to me. Like, they've been sleeping on the couch. They're so mad at me because I did. I ran down Kevin. I ran up and then down it, and it was the down that killed me. Eccentric is well known for far more, what does it say? Micro trauma to soft tissues and a higher incidence of, what's this? Delayed onset muscle soreness.
It's like where you work
2 days
out,
after.
like
We're gonna
7
hit
days.
that, hopefully today.
Is worse than.
Yeah, it's coming. Although an optimal, just read through this next paragraph with me. Although an optimal frequency per week has not been determined, a few generalizations can be made. Initially in an exercise program, short sessions of exercise sometimes can be performed on a daily basis, several times per day, as long as the intensity of exercise and number of repetitions are, what? Low. The frequency often is indicated for early post-surgical patients when the operated limb is immobilized and the extent of exercise is limited to non-resisted isometric setting exercises to minimize the risk of muscle atrophy. As the intensity and volume of exercise increases, a frequency of 2 to 3 times per week, every other day, or up to 5 exercises sessions per week is common. Now what you did was you built your poster board along with the American Heart Association, American College of Sports Medicine said 3 to 5 times a week, right? So it gives you frequency there. What we're unclear of is with resistance training. What's really good? You know, I see a lot of guys going to the gym and they really want to pin this down. I mean, this is their interest. Their interest is not, you know, have I figured out how much weight to lift? It's, have I figured out how often I can go back and lift it? The interval is really the crux. We don't know where the best part of it is. Frequency is tough because you can overdo it more than you can underdo it.
It's an ACSM 3 days a week.
3 to 5, isn't it? 5 more is almost always better. Did I say that right?
I don't think it was 5.
Yeah, you can do 40 minutes, 5 times.
Yeah. It's just, what did you do to your duration? You have to crunch it. Now, this is just for the lay sedentary person too. What I'm trying to get into here is what is our frequency best? Well, the book even says it. We don't know. We don't know. All right. So take time to read through that and digest the next paragraph. Looking at duration, I'm in the notes, I'm in the book, 174, looking at duration, the amount of time for one single session or a total program. Also, duration says total number of weeks or months during which a resistance exercise program is carried out. A lot of times they write durations on your prescription to treat as 3 times a week or 4 weeks, 6 weeks. That's your duration. A lot of ACLs are coming out to the clinic that you're working in, and they're getting 6 weeks of therapy. 6 weeks. 6 weeks. Now let me just throw this at you. Most doctors don't let an ACL run for 3 months. And you only get it for 6 weeks. Hope you can write a good HEP.
Do
And
you
I hope
find
they're
that most
compliant.
insurance companies allow that same allotted time, or does that vary per insurance
It
company?
varies. it's really insurance who's dictating that too.
You say 6 months, you say the insurance can only send, is it so many visits, or just a week, and so many weeks and then it's gone, the insurance?
Usually they can write it for so many weeks. Now, some insurances will let them write after that 6 weeks for another, they'll let them write again, but I don't know.
I didn't know if it was visits, wouldn't you wanna do like 2 or 3 visits, and then maybe go a month, and then 2 or 3 visits?
Well,
If you could do the home exercise with them,
you could possibly get it broke up like that, I don't know. I don't know if they're gonna let that
if they
happen.
could, that would be better.
It's been a very long time since I've worked in the outpatient setting, and I don't know what changes have probably been made. But a lot of times, what we saw was 6 weeks,
If they could though, would that be better?
yes.
See them say maybe,
Well, the only variable is if they're compliant with a home exercise
that's what
program.
I mean.
If
Like
they're
a
compliant,
young person, you might be, like that athlete that hurt his knee, you might be more compliant than an old person.
yeah. And this is where, you know, in my mind, athletic trainers really can help in the whole process. But also you need to know, athletic trainers are not trained in the Ther Ex component that you guys are. And so we don't have that as in-depth as you do.
You just took it to another level, didn't you?
Yeah, I'm taking it way outside of the scope of this class.
No, I'm talking about you. Of course, athletic trainer, you know more because you're in this program and everything too.
Yeah,
That's what I mean.
the things that I talk about in here are clearly because I went through PTA, not because of athletic training. And then what I did in exercise sciences outside of my post-bac studies. So that's where that comes from too, Rick.
Cool.
Let's talk this real quick. Integration of rest into exercise. Here you go, here's where it is in the book. The rest intervals for each exercise muscle group are dependent on the intensity and volume of exercise in general. The higher the intensity of exercise, I don't know, can I beat this dead horse more? The higher the intensity of exercise, the longer the rest interval. For moderate intensity resistance training, a 2 to 3 minute rest period for each set is recommended. Shorter rest interval is adequate after low intensity exercise. Longer rest intervals greater than 3 minutes are appropriate with high intensity rest resistance training. So, I mean, again, it's just beating this dead horse, is it not? High intensity, more rest. Low intensity, less rest.
So if you read just past that, then if they was doing squats, it might be greater than 3 because it's larger muscles.
Yeah, maybe.
Is that kind of what that means?
Yeah.
Multi-joint, it says there, well,
That's right. So if it's a squat, that's a big movement.
it could be more than 3.
If you wanted to get back to that 90 to 95%.
Right.
So look at this in respect to the reps. We're talking, and the magic number is 3 sets of 12. It's very clear that Kisner here likes 3 sets of 12. I mean, if you read through the chapter, she likes 3 sets of 12. So if that's the thing, if that's the number, you guys are like, well, how many ankle pumps do we do, Kendall? How many short arc quads do we do? How many straight leg raises do we do? How many do you do? There you go.
The PT that I worked for hers was 2 sets of 12. Every time I asked, it was 2 sets of 12.
Well, and I wanna address where we get sets from in a minute.
So would you adjust your intensity to try to fit inside that? What you do? Okay.
And then you're like, well, how do I know what kind of resistance to put on this? Well, first of all, you start with no resistance outside of gravity. That's where you start. And if they knock out 12 pretty easy, guess what you need to do?
Add resistance.
You need to add resistance.
Jump on their back, now squat.
There you go.
I don't want to go
Well, I was thinking like Susan.
Get up off the ground and do it.
If I jumped on her back, it'd just be.
Look at the integration, well, let's just skip over to this next page in our notes. Mode. mode of exercise, this is the form of exercise, the type of muscle contraction that occurs, and the form of resistance used. So here we go into mode, and I've talked to you, and I will talk more, it won't be until Monday, about isometrics. But let's look at this real quick. We talked about short arc quads and long arc quads, remember a few weeks ago in lab. All of you in your chair could perform a long arc quad right now, right? A short arc, though, resistance through only a portion of the available range of motion. It's used for avoiding a painful arc in the range of motion. My knee patient, doing quad sets. Where is her painful arc? Extension. I measured her the other day, she's 10 to 95. Now what does that mean? To 0, right? Okay. That's what hurts. Does that mean I completely avoid it though? No. I don't want to completely avoid it because I gotta introduce that. It hurts, but I gotta get there. Where a joint is unstable, I see this a lot in shoulders, but also a short arc quad is heavily contraindicated in early ACL repairs. And Bill will tell you that he'll give you a couple ideas on this, but every doctor I've worked with has said don't do short arc quads in an ACL repair because the ligament is unstable in that open kinetic range. Did you hear that? Open kinetic range, right? And so we don't want them doing this like a basketball in or anything because that ACL, that graft is unstable. Now Bill will tell you what you can and cannot do in Ther Ex II, and that's what he's gonna do. So we'll leave that dialogue for him. Where tissues need to be protected after surgery. Think about a hip. I told you what the hip precautions were. Jerry asked me the other day, did you go over hip precautions with these students?
Yeah, it was on our midterm.
But did I go over it?
Well, you just told us there was 2 different kinds of hip precautions, but we didn't, I don't know if we really went into great.
Well, remember, I told you, you can't abduct.
Right.
I'm sorry, you can't adduct. You can't internally rotate.
Or flexion.
Yeah, so it looks a lot like this, doesn't it? Can't let him do that. Oh. Hang on, I'm gonna stretch my piriformis for a minute. So, how'd you do on that question?
Did you say internal rotation or external?
What, is that why she texted me about it?
External.
Well, but my question was, she said that she mainly, even though they're 2 separate sets of hip precautions, they kind of go together and they're kind of almost the same. So that's not what I was thinking when I answered that question.
So flexion, not past 90, no adduction. I miss the internal, external rotation. I get it wrong every time. External.
Well,
Internal.
if you're saying that, that's.
Is it internal? Because like, you just external, right?
Yeah, it's external.
Okay, I'll remember now after seeing you sit like that.
Yeah, that's how I remember
If you
it.
would've sat like that in lab, I'd remember. Cause I did internal
Can't do that.
rotation and I missed it.
I chose internal.
It's really like, I guess that.
See?
Can't do.
I thought you guys chose external.
I did.
Oh, okay, I chose internal.
I chose external and missed it though, Kendall.
I chose internal.
Did you miss it or get it right?
I got it right.
See? They chose internal and got it right. I chose external and missed it.
I don't know, I think it depends on the approach. Posterior, or is it anterior?
That's what we thought too.
Hey,
See, that's why it made that question hard to answer.
See?
I'm going in and editing this whole conversation. Alright,
Cause I put
Wait a
external
minute.
and missed it.
Will you tell us
That one that
the
she gave us in the morning?
posterior, which
See,
was
I
the
put external and missed it. I put
External.
external and missed it.
I know, yeah.
Was that on this?
okay, so, real quick.
I think I got it right.
I put
Um,
external
I don't
and
remember,
missed it.
there's too many tests.
we we are gonna start into the types of, so you're flipping over to page 178. These are the types of muscle contractions, and I go in depth here on isometric more than anything, because isometric is clearly the least understood about what things can really be applied.
Is that what you use like a lot in acute, you said?
You use it a lot in acute. This is a static form of exercise, and I really need you to understand static. Static means no movement, which a muscle contracts and produces force without an appreciable change in the length of the muscle, without visible joint motion. On page 179, in your notes it says 169 because it's out of the old book. This is 3 types. One is there's muscle setting. Quad, what? Sets. Alright? A quad set, in its finest form, you shouldn't see any joint movement. But a lot of times we do. And the way I teach people, and like I showed you guys, is I slide my hand underneath their knee and I say, squish my hand. It's good biofeedback. So I've got my hand underneath their knee, they're squishing, 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 and I can see some joint movement there. All right, let's just be real. Quad sets are great for knees early.
Do you
Because
put
they
your
really-
hand under there for the glute muscles too?
I do not.
For total knee, right?
I do it like this.
Oh, there you go.
Um,
Are you talking about for a total knee?
I'm talking for any knee. Quad sets on a knee patient every time.
So you-
Every time.
okay.
Whether
Even
it's a
on
total knee,
ACL?
whether it's an ACL, whether it's a meniscus, lateral release.
Okay.
So will it work?
Can you think of any other knee surgeries? Well, that's usually with the ACL. They're not going to repair a lot of MCLs unless it's a
Like a
meniscus.
torn patella, like that football
Or
player?
patellar tendon. They're probably going to do quad sets.
So would it work for somebody that's already like recovered from the surgery, just still has knee pain sometimes?
Maybe. Yeah, I do a lot of quad sets for people who have, and you may or may not understand this one yet, patellofemoral pain syndrome. It has to do with the tracking of the patella through the femoral
We
groove.
just covered it.
Yeah.
Okay, good. We'll do some quad sets. Quad sets are just like, bam, every time. And they seem simple, so we don't utilize them a lot. They're like, we don't need quad sets, we need squats. Whoa. Let's just go slow here. Stabilization. Please go through muscle setting in that paragraph and notice that in these 2 paragraphs, there's a lot of information. In the first paragraph, they are used to decrease muscle pain and spasm and to promote relaxation and circulation after injury to soft tissues during the acute stage of healing. Right there. Good to do setting exercises. And the lady, like I said, I still do them. They hurt. But she does a lot of other stuff too. And that may be a lot of her pain still. The next one is stabilization exercises. On the next page. Used to develop some maximal but a sustained level of co-contraction to improve postural stability or static dynamic stability in sitting or standing. Examples include rhythmic stabilization and or alternating isometrics. Can I borrow your left arm, Miranda? All right, Miranda's going to do stabilization exercises. Are you ready? You resist me in the direction that I push. Are you ready? Here we go. Up, up, Can you tell how this is going to tell her a lot about proprioception? Yeah? Think about doing that with an ankle. Holy moly, if an ankle sprain happens, could you not do something like that? Crumb bum. Who really wants to pull out TheraBand and have them do dorsiflexion and plantar flexion, eversion and inversion. Boring. Do some of this, for crying out loud. It's exciting.
Well, you can interact with your patient more too that way.
Yeah, and are you gonna take your date to Western Sizzlin', or are you gonna take them to Ted's Escondido? Automatically, it sounds more exciting. Take them to Ted's Escondido and do some stabilization stuff with them, right?
How would you do like your sets and reps or something like, I know there's not a set or rep
I do it for time.
period of time.
And we're gonna get into, you would do time. You use the same set rep ratio for strength and endurance. So time works better for endurance though, than saying, let's do 50 of these, right? Let's do time. Let's do for 1 or 2 minutes. 1 minute is typically your starting point, going up to 2 minutes, getting more endurance. 3 minutes would be bigger, right? You see where that's going?
Would you just do it one time though, at 1 or 2 minutes?
I would do multiple sets, and I'll get into, we're gonna get into that in a minute. Actually, not today, we won't get into that. There is a complete theory out there on why 1 set is not as good as 2 and 3 sets, and I'll get into that. Multiple angle isometrics. This is where resistance is applied at a multiple joint positions within the available range of motion, either manually or mechanically. Let me have that left arm again. Okay, so, ooh, she's already pushing. She's excited. Relax it down just a little bit. Okay, so we're gonna do shoulder abduction. All right, isometrics, multiple angle. 5, 4, 3, 2, 1. Relax. Go. 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 5, 4, 3, 2, 1. Relax. Not very Ted's Escondido, is it? But very, very effective. What?
Would that be
But it's not the soup
like
kitchen either.
multi-planar too? In all
That's
planes?
right. What?
In all planes, could you do that too, or is that
Yes.
more of just?
Nope. No, but if you start randomizing and doing it quickly, that's a stabilization. If you want
hold like that?
clear, very cut plane, we're changing the angle of that plane and we're resisting in different angles of that plane. That is the multiple angle.
Could you do that like in that PNF that we, D1, D2 learned the other day? Just take a beat
Yeah,
step?
absolutely. Yeah, that's finally. Yes, did you catch that? Did everybody catch that? We're taking them into the plane of PNF, D1, D2, and doing what? Multiple angle isometrics, or stabilization, or eccentric concentric. Are you getting equipped here? Are you gonna walk into your first clinical and say, stand back?
That would
Yeah,
never happen.
I don't wanna hurt you, Sid.
Look, I don't have to say
They would
that.
think you had gas.
Love it. Turn over to the next page and I'll end this up. Characteristics and effects of isometric training. 60 to 80% of muscle force developing capacity. That means you can get to 60 to 80% of the muscle force developing capacity. Muscle force, not muscle strength. Okay? Here's one thing I need you to understand. Gosh, I thought I had it highlighted here. page 179, under the paragraph with the green that says types of isometric exercise. Listen to this part. Because no appreciable resistance is applied. Resistance is applied statically, as the muscle contraction is static. That's what that statement means,
Where you
okay?
at now? Sorry.
179, types of isometric exercise, middle of the paragraph,
Okay.
right after parentheses endurance. Because no appreciable resistance is applied, muscle setting technically is not a form of resistance exercise, but is included in the discussion to show a continuum of isometric exercise that can be used for multifaceted goals in a rehabilitation program.
Yeah, it does.
What?
I thought it was just me, but my book literally says retard. Yeah. It says something different.
Second on the last sentence, right above the dot.
Where did it say retard?
Setting.
Yes,
Sure does.
exercises can retard muscle atrophy.
Yeah, it says
Slow.
something different.
In fact, the line above that, that's the one I wanted to find too. Because muscle setting is performed against no appreciable resistance, it does not improve,
Oh, right here is what
it does not improve what, right there?
Muscle strength.
Muscle strength. Does everybody hear that? Because I guarantee you there's a test question on that.
Okay, where you at then?
Because muscle setting is performed against no appreciable resistance, it does not improve muscle strength except in
Very weak muscles.
very weak muscles. So when you hit, what's that for? My sweatshirt. Oh, thanks. So when you hit a question that says isometrics does this, one thing you're not gonna choose is muscle strength, improve muscle strength. Because what the text tells us is that it only does it in very, very weak muscles.
So it improves
So what
endurance?
your question is gonna probably say is something that is a person who has outstanding strength in their muscles. Are you all with me?
So what is it improved in, endurance?
It improves the
Probably just decreases breakdown of muscle.
force developing capacity. I wanted to make sure I said it right. Look on the next page of notes. The force developing capacity.
Where's that at? In our notes?
Characteristics and effects of isometric training, right up at the top of the page.
The same page we was on.
Force developing capacity. Got it? It develops the force developing capacity. What else does it do? Duration should be 6 to 10 seconds. Notice how every time I do it, I count from 5. Like I start, I say go. 5, 4. I just don't like to start at 6. It just bothers me. So I go. 5, 4. But 6 to 10 seconds should be your duration. Repetition should occur consistent with endurance and strength goals. So if you want to build their strength, how do you do it with isometrics? What?
With leg movement.
Nope. How do you do it with isometrics? How do you increase strength? What'd I tell you? Strength doesn't really get it, right? Except for in very, very weak muscles. Okay? So endurance is more about what we're gonna get here. And force developing capacity. Remember, what's the first thing to go? what's the first thing to go with atrophy? Slow twitch, type 1 muscle fibers, first thing to go. So what are we looking at? We're looking at endurance, possibly, strength not so much. Force developing capacity, yes. Fourth bullet, resistance at 4 to 6 points of the range of motion if you're gonna use, write this next to that, multiple angle isometrics. If you're gonna do multiple angle isometrics, you need to go to 4 to 6 points. It says that under multiple angle isometrics talk in your book, but go with 4 to 6 angles. Now, look with me real quick, last thing, I promise, 180, precaution. On page 180, it says precaution. Caution. Breath holding commonly occurs during isometric exercise. What the heck is that called? Phew. You gotta watch it. Isometric people will do it. We'll start on Monday with dynamic training. We'll start in lab day with the repetition max. Y'all got me all sweaty. Today Wednesday? BCM lunch day? Carrie, you talking at BCM today?
Yeah.
I didn't prepare anything, so.
Why don't you go pray about it real quick, and I'll tell them you're talking.
I'm ready for it.
I'll throw Jessica under the bus.
Why would you do that?
Forewarning me.
You would what?
Throw Jessica under the bus. Maybe more like Amy. She's always prepared for stuff like that. Look at her face.
Her face,
Her eyeballs are gonna pop out of her head.
she got the crazy eyes on there, she's like,
Look at her
you better
face.
not.
I'd throw Josh under the bus.
Yes, Josh would be great.
Yeah, pastor son will have backup sermon.
Yeah, throwing you under.
I don't have sermon, it's already here, baby. Already.
You just speak from the heart, wouldn't you, Josh?
Just open up my heart and let baby Jesus talk. 8 pound, 2 ounce,
Go in there.
balled up little fist.
Little baby Jesus.
life-sucking day.
It might not be.
It might not be, you're right. Pass this class first.
Where is this class?
You should be.
I'm not.
Bill said he didn't talk.
No, he doesn't. I'm sure if he needed to talk to me, he'd already hit me up for it.
Well, he's been ready to hold that conversation.
Eat plenty of almonds, 'cause I'm.
Jessica, I don't like you, so you're kicked out of the conversation.
Yeah,
You're
'cause
too bold.
that would have to be the reason.
I need to go pee before this class starts. What is that for?
Ventilation,
Cereal and
sucks air into here.
Yeah.
Air in.
Wow, I actually can cook dinner. I cooked dinner for the first time.
I saw that. I mean, at first I was
It was like the first night, and I can't remember how long I haven't been at the library.
chicken legs.
It's like,
We stayed and wrote our paper for like ever. So I didn't get home till 6:30.
We're gonna start on ours today.
There's just so much information.
To rewrite the numbers.
Don't be prepared to finish today.
Don't.
Oh, no, that's why we're gonna start today, to get a start on it.
Tammy worked at the library for like 6 hours and then I got 4 pages.
It would've been nice if we would've done all of that before we did it.
did you use one of the papers in here as a guide?
They're kind of,
Really?
yeah, like, I don't know how they got nice.
Oh, they probably didn't read
Okay,
it.
y'all got 95 in the first one.
After the first page, he's like, this is a little bit.
Yeah.
That's what I'm talking about. Yeah. It's pretty bad. Like, how are they not have spell check? I don't even know.
Gosh, there's so many different national hands going.
There is nothing.
Courtney was great at it.
Oh, yeah, she's a literary master.
Yeah, I wouldn't even turn mine in. I'd just like, give me a 0 for it. I need to let you do my paper.
I like say something, she's like, no, that's not going in our paper.
How about you just let me write it, and you just,
You sit there.
you find the page in the book
You just cut out clouds.
Courtney, are you like that?
She is.
on the inside.
I'm saying, she's like,
She knows what she wants.
I'm like, or I say,
Or I.
you shoulder joint, she's like, don't start with these. I'm like, sometimes shoulder joints or joints that are in the shoulder.
Yeah, you'd have to hate it.
No, I've always liked my papers.
I
You found
hate
out the way you were doing it was totally wrong.
It's awesome. We're setting the bar. We're not doing it.
Well, I think Tara's better at writing papers than I am, and she's picky, so she wants to be picky, she can do it.
Good at that.
Information comes out of my head like vomit, and so it's not very organized. It's like everything all at once.
This one's here. This one's here.
So bad.
That's what this is.
It's a blessing and a curse. My brain just goes so fast.
I just can't control it. Fingers can't keep up. So there's so many typos.
No, my mom kind of hurt my feelings over the weekend. experienced that.
Okay.
Like, when it, as soon as it turned cold, the tire pressure, gauge came on my car and his truck.
It's not supposed to do that.
You know what, we had,